When the number of monkeypox cases exploded last month in countries like Portugal, Spain, and the United Kingdom, where outbreaks don't usually happen, there was a quick global response. In some countries, vaccines were given out, but there have been monkeypox outbreaks in parts of Central and West Africa for years, and researchers there are disappointed that these kinds of resources have not been made available in their countries where the disease has killed the most people. They say that they have been warning for a long time that the monkeypox virus, which has been acting in new ways, could spread more. In this video, we are exploring the recent monkeypox outbreaks, as well as the story behind the African outbreaks that have been unheard of for years, and whether we and the rest of the globe should be worried of another global pandemic. Before we get started, if you like to stay ahead on knowledge and life tips, be sure to subscribe to the channel and turn on all notifications to stay up to date with our latest videos. Vaccination against monkeypox begins. Can the outbreaks around the world be stopped? There have been more than 3,000 confirmed cases of monkeypox in places other than Central and West Africa so far in this year, but no deaths have been reported. In Africa, on the other hand, health officials have heard about more than 70 deaths they think were caused by monkeypox. Dimi Ogonia, an infectious disease doctor at Niger Delta University at Amasoma, Nigeria, says that this number is probably low because there aren't enough testing and monitoring tools. Even though it bothers him that Western countries have mostly ignored monkeypox until now, Ogonia worries that the current outbreaks around the world won't make things better for Africa. Quote, "If we don't get the world's attention on this, a lot of the solutions will work in Europe but not in Africa," he says. Having dealt with outbreaks. Before this year, there had only been a few cases of monkeypox outside of Africa. These were linked to animals brought from Africa or to travelers who had been there. The one that made the most people sick was a short-lived one in the United States in 2003. It was caused by animals that were brought in from other countries and made more than 70 people sick. Monkeypox spreads around the world. Why scientists are worried. Since 1970, when scientists found the first human case of monkeypox in the Democratic Republic of Congo, or DRC, monkeypox has been spreading in some African countries. Researchers still don't know for sure which animals naturally carry the virus, but they do know that it spreads among many types of rodents and can be passed from animals to people. In 2017, there was a big outbreak of monkeypox in Nigeria, with more than 200 confirmed cases and 500 possible cases. In the DRC, there have been thousands of suspected cases and hundreds of suspected deaths in the last 10 years. The strain of monkeypox virus that has infected people in Central Africa is more dangerous, with a death rate of about 10%. Epidemiologist Adesola Yinka Ogunleye at the Nigeria Center for Disease Control in Abuja says that the current global outbreaks make her feel like she's seen it all before. Before the 2017 outbreak in Nigeria, the virus seemed to only be in rural areas where hunters got close to animals. It would show up as a fever and spots on the face, hands and feet that looked like pox and were filled with fluid. After 2017, she and other epidemiologists warned that the virus was spreading in a way that was unusual. It was showing up in cities, and people with the virus sometimes had sores on their genitalia, which suggests that it could spread through sexual contact. Now that the virus is spreading in Western cities through what seems to be close contact with sexual partners, she says, quote, "The world is paying the price for not responding well enough in 2017." End quote. Human immunity has gone weaker. At the same time, researchers have been warning for years that there are more cases of monkeypox in sub-Saharan Africa. Part of the reason for this is that countries stopped giving people smallpox vaccines. Smallpox is caused by a virus called variola, which is very similar to the virus that causes monkeypox. Since smallpox was wiped out in 1980 and vaccination stopped, more people are at risk of getting it and getting monkeypox. Since then, some countries have kept national stocks of smallpox vaccines because health officials were worried that labs with samples of variola might accidentally let it out or that the virus could be used as a weapon. Countries like Canada, France, the UK, and the US have been using these stockpiles as part of a strategy called ring vaccination to protect close contacts of someone who has the monkeypox virus. Recognizing that many of the cases have happened in men who have sex with men, or MSM, authorities in several cities in Canada and the UK have taken it a step further and started giving the vaccines to MSM communities in those places. Steve Ahuka, a virologist at the University of Kinshasa, says that these vaccines would help stop the outbreaks in Africa. However, African countries don't have large stockpiles of these vaccines, and Western countries haven't given their monkeypox shots to Africa. Ahuka and Yinka Ogunleye both say that if they had vaccines, they would at least suggest that frontline healthcare workers and lab technicians get vaccinated. Other researchers said that shots could help stop the spread of monkeypox in Africa if they were given to people with weak immune systems and people who spend a lot of time around animals. Lack of funding. Some health officials in sub-Saharan Africa are worried that they will keep falling behind because they didn't get enough vaccines during the COVID-19 pandemic. Even though the number of cases is going up, only 18.4% of people in Africa have been vaccinated against the coronavirus SARS-CoV-2. In high-income countries elsewhere, 74.8% of people have been vaccinated. Monkeypox outbreaks. 4 important questions for scientists. More than 31 million doses of smallpox vaccine have been promised to the World Health Organization, or WHO, in case of a smallpox emergency. However, these doses have never been sent to Africa to treat monkeypox. Rosamund Lewis, the technical lead for monkeypox at the WHO, says that part of the reason is some of the agency's pledged stockpile is made up of first-generation vaccines, which can have serious side effects and are not recommended for monkeypox, which is less deadly than smallpox. It is interesting to note that Lewis refused to say exactly what was in the WHO's promised stockpile. She also talks about regulatory issues, meaning that some member countries have only given permission for the vaccines to be used against smallpox, not monkeypox. Even though the vaccines have only been tested on a small number of people with monkeypox, they are thought to be safe and effective for people with smallpox. Lewis says that efforts to stop monkeypox in Africa have not yet been as successful as they could have been, but that the money spent has not been wasted. She also says that the WHO has been working with African countries with outbreaks of monkeypox to improve monitoring and diagnosis. In recent weeks, the WHO has noticed that monkeypox is getting different amounts of attention around the world. On June 17, the agency said it would no longer report monkeypox cases and deaths in sub-Saharan Africa and the rest of the world separately. This is because, quote, a unified response is needed, end quote. And after researchers published a plan to change the names of the viral strains of monkeypox, which are currently called the West African clade and the Congo-based clade, WHO Director General Tedros Adhanom Ghebreyesus came out in support of the name change to reduce stigma. He said he would, quote, tell everyone as soon as possible about the new names, end quote. People were affected by smallpox and other viruses much earlier than was thought possible. Even if the countries in sub-Saharan Africa get vaccines, says Oyewale Tomori, an independent virologist in Ibadan, Nigeria, inoculation alone will not get rid of monkeypox. He warns that vaccinations will only work if health officials understand the local epidemiology of the pathogen. There are still many questions about how isolated cases of the disease have continued to pop up all over the affected countries in sub-Saharan Africa. He suggests funding research to find out where the monkeypox virus comes from in animals so that health officials can come up with better ways to stop the virus from spreading. Quote, if you don't deal with the core problems, you'll end up using all your vaccines on monkeypox, end quote. He says, instead of dealing with the source of the problem, which is contact between animals and people. Strategies to speed up testing for monkeypox are also important, says Ogonia, because the faster a case can be confirmed, the sooner public health officials can start taking steps to keep it from spreading. He also says that sub-Saharan Africa can't get these changes soon enough. Quote, isolated solutions that fix the problem for developed countries but not for developing countries will put us back in the same cycle, he says. pointing to the past outbreaks where a pathogen keeps coming back. Quote, "It will happen in due time." End quote. And that's it for today's video. What do you think? Is the world in danger of another pandemic? What do you think should be done ASAP to prevent that from happening? Let us know in the comment section below. If you learned a lot from this video, consider smashing the like and subscribe buttons. Turn on all notifications as well so you don't miss any of our latest videos. Thank you so much for watching, and I'll see you in the next video.